And welcome back. Thank you for joining us. Dr. Colantonio with us. One thing we didn't get a chance to dive into, and that is, in terms of pain management, another way of dealing with pain, something that has been coming up in the news quite a bit and has been, it's been interesting to kind of hear all the information that's coming out, and that's the cannabis side of it. Let's just touch upon that.
Yeah, huge topic. Talk about evolving. That entire industry is evolving and emerging. And at this point, that's become an important piece of what's in our arsenal, at least at my clinic, for how we can offer something new for patients to help control their pain. Cannabis, at this point, the quality control is my biggest concern about cannabis in general. Unfortunately, there are many companies that have come out with finished products that they're promoting at convenience stores, online, direct to consumer, and there is no regulation in place at this point about quality assurance. So you're really at the mercy of the company that's putting the product out there. As far as, is any of what's on the label actually in that bottle?
Wow.
Or in that tube, if you're talking about a topical. And I would argue the majority of companies, if no one is looking or checking for quality assurance, they are not going to spend the bottom line dollar on quality control. So I haven't had much trust for product in general, other than product coming from a licensed dispensary, since of course it's medically approved here in PA for at least 23 medical conditions, cannabis that is, or it so happens we have an excellent quality facility right by us in Waterford called Formulated. So unless it's coming from a company that I personally feel very confident in the quality assurance, I'm skeptical. So we've had many patients come and ask about cannabis. Many of them have tried these other sources, online, direct to consumer, picked it up while they were getting gas, that sort of thing.
Yeah.
And it did nothing for them. They had no side effect, but they also had no pain relief. And I have explained to them, I would argue what was on the label was probably not even in that bottle, and you basically had a placebo product. So we then engaged in a conversation about preferred product that we trust, and or a medical cannabis card through the state program. And I've been impressed over the last several years. I started certifying patients in 2019 for medical cannabis, with how many folks, after getting appropriately educated, really came around and accepted cannabis as an option for themselves. There's a lot of stigma around it, and for that reason I think a lot more education is necessary, especially for medical purpose.
And why is that different, maybe better than taking the Tylenol, the Advil, whatever the...
Yeah, great question. So many of our patients struggle with arthritic conditions. Their pain is largely driven by inflammation of the tissue. And they turn to NSAIDs, or as you mentioned, ibuprofen, Aleve, Motrin, Advil, or steroid, pure steroid. So pure steroid can come in a Meadville dose pack that's prescribed in tablet form, prednisone, or injections. And we do steroid-based injections at my clinic. Many clinics that see musculoskeletal pain use steroid. What patients should know, there are a lot of risks with both of those categories, NSAIDs as well as steroid, and we counsel patients on this all the time. With NSAIDs, they are known to elevate blood pressure. They're associated with developing potentially gastric ulcers, as well as potentially injuring the function of the kidneys. Those things, fortunately, will show up in lab work, so they can be detected in time before there's a major problem. But gastric ulcers, bleeds, damage to the kidneys can cause long-term health problems for patients. And most patients don't follow what's on a bottle. They'll take a little more, almost self-experimental, and you can really get into trouble doing that. With steroids, there are, again, negative issues with that. Weight gain. They suppress the normal production of cortisol in our body. So we naturally make steroid called cortisol. It comes from the adrenal glands. And if you're getting an outside source of steroid regularly, like every couple months when you go to this clinic, that clinic, the other clinic, there's some shot of steroid that you're getting, that adds up, and eventually it could shrink those glands down to the point where they don't function anymore. That's a medical problem called adrenal insufficiency. It can leave you very fatigued. It can even cause electrolyte disturbance in the body, which can lead to heart attack and even abnormal brain function. So they're high-risk medications, is my point. To what we know right now about cannabis, and in particular CBD. So medical purposes are going to have very little, if any, THC in them. So CBD is a major cannabinoid that is part of the plant, the cannabis plant. And if you think of it, ice cream is a general category, like cannabis. There's flavors of ice cream. There are cannabinoids or flavors of cannabis. CBD is one of those. And there's a lot of animal data about CBD and its effect on inflammation in a good way. A lot of the data is animal-based because of the regulation from the FDA and the DEA. Still at this point, cannabis is in a category of Schedule 1, which I don't agree with, and there are many physicians that don't agree with that. The FDA even now doesn't agree with that. They released a statement in April encouraging the DEA to change that classification. Schedule 1 means the substance does not have a recognized medical purpose or benefit. So other drugs in that category would be meth, cocaine, and heroin. Now, there's no way I feel clinically cannabis should be in that group. And as I mentioned, the FDA has changed their position as recently as April on that, suggesting the DEA move it to Schedule 3, which would actually put it a schedule level below narcotics, but still something that should be monitored and controlled by the DEA. That would be a win if and hopefully when the DEA decides to follow that recommendation from the FDA. That'll open the doors to human research, which we have very little of right now, except for seizure disorders. I think also hopefully open the door for pharmaceutical companies to start developing more product options for us as providers, so that we have alternatives to NSAIDs and steroids. In the meantime, finding a quality, trusted provider of a cannabis product is very reasonable, and it's a big part of our practice.
So when you drive through an area and you see a store that offers that, it's not all the same.
Not all the same at all.
It's best to contact their physician.
I would encourage every patient to talk with their physician about cannabis if they're interested in a medical cannabis card, or they're even thinking about going to a dispensary. That's another conversation I've had with many patients. I think I'm going to go to that dispensary. And they're thinking about going to literally somebody that put the word dispensary on their shingle. They are not a licensed dispensary by the state of PA. Products should only come from a licensed agricultural site, and those products end up in a licensed dispensary. So there's audits that occur for those agricultural sites and those certified dispensaries, so you know the product is what it says it is. Other than that, it's Vegas, and it's a long shot that you're actually getting what you think you're taking.
And every patient's different. So if somebody comes into you and says, well, I think I should be taking this, that might not be the case because of whatever issues they may have. You may say, well,
correct. Yeah,
I see what you're saying, but this is the path that we should go down.
it should not be a trivial choice. Again, encourage patients to talk with their provider about what they're thinking of trying, and then the provider, my role is to guide them through the choice of eventually pursuing a cannabis product. Our patients are all interested in pain relief. They are not at all interested in a euphoria or a high. And products that they're utilizing are extremely low, if any THC product is in there. The dispensaries have THC product. There's animal data, again, that THC combined with CBD has a synergistic effect and is more beneficial than either one alone. But there are folks that can't tolerate any THC in the product. They have some form of a side effect. So there are baseline conditions that should be discussed, especially psychiatric history, schizophrenia, psychosis. Patients that have those conditions, those are higher caution conditions to move forward with in the setting of taking cannabis. So a number of medical boxes should be checked and discussed with a provider, an experienced provider, before someone tries this. It should not be a trivial attempt from a patient.
Well, and if you have questions, contact your primary care physician to get started with that conversation. And if you are suffering from any sort of pain, chronic pain, they can ask to maybe be sent over to you.
Absolutely, yeah. They can have a referral over to us that's specific for medical cannabis conversation. We take the process seriously. It's a rigorous process and thorough by design at my clinic. There are, and I'll caution folks about this, there are online ways to get certified. It's 8 to 10 minutes. You talk to a provider that you never met. They'll certify you because they'll take your credit card and they'll certify you for sure. They supposedly conduct a medical history, etc. I don't have much confidence in those paths.
Okay. Leave it to the professionals. And what a great topic and great information. Thank you very much.
Sure, you're welcome.
And thank you again for joining us.